Hi, my name's Claire and I'm an infectious diseases registrar at Addenbrooke's. This video, recorded on the 8th of January 2021, is designed as a basic introduction to looking after COVID-19 patients, aimed at junior doctors working on red wards. First, please make sure you look after yourself, physically and mentally. We'll have an infection control video as part of this series with the latest PPE guidelines. Remember to follow the displayed donning and doffing procedures and not to remove your PPE in a clinical area, except when changing apron and gloves between patients. Wash your hands regularly and thoroughly, especially when leaving a clinical area. Please make sure you've had your COVID vaccine, have been fit tested, and are taking part in the staff asymptomatic swabbing programme. Take your breaks, eat and drink regularly, and look out for the rest of your team. Try to find ways to decompress when you're not at work. Exercise, fresh air, getting enough sleep, and talking to people are all really important. We'll also have a sources of support video with more information about who might be able to help if you're struggling. When you're looking after patients with COVID-19, respiratory support is key. Give oxygen to maintain target saturations, either via nasal cannula or venturi mask for higher concentrations. Titrate the flow according to saturations. Patients are likely to need adjustment of their oxygen levels daily as their condition improves or deteriorates. All patients who have any features of severe COVID, particularly SATs of less than 90% on air, respiratory rate more than 30, or severe respiratory distress, should be treated with dexamethasone. The dose is 6 milligrams once daily, given orally, although IV options are available if needed. The course is for 7 to 10 days or until the patient is discharged, whichever is sooner. It's really important to ensure there's a clear escalation plan for all patients on the ward, and this should be discussed early. So on a spectrum from ward-based care to intubation and ventilation, what are the patient's priorities and what would be most appropriate for them? Would they accept high flow oxygen, CPAP, intubation, CPR? Making and clearly documenting a plan should be a priority for all patients. If any patient is unwell, remember to follow an ABCDE approach to assessing them, identifying issues and correcting any treatable problems as you go. For any patient you're concerned about and any patient requiring 4 litres or more of oxygen, call the rapid response team. You should use an SBAR referral to communicate the patient's current situation and the problem, and ask the team for advice, which you can implement as they may not be able to attend immediately. Ask questions if anything is unclear or you don't understand. While awaiting RRT, please organise a chest x-ray and an ABG and correct any problems which can be corrected. If the chest x-ray findings don't match the patient's level of oxygen or clinical status, please arrange an urgent CTPA. For patients who are deteriorating but not appropriate for further escalation, ensure you're clearly communicating the situation and likely trajectory to the patient and their family. Establish the patient's preferences wherever possible and contact the palliative care team for further advice. We'll have a separate video on care of the dying patient with COVID in this series. Good communication with patients' families is essential as they won't be able to visit and will be understandably anxious about their relatives. It's easiest to agree with families that you'll phone them with updates in the afternoon unless there's an urgent reason to call sooner, in order to avoid multiple phone calls to the ward in the morning, which take up the nurse's time and interrupt the ward round. We know it can be really daunting working on a COVID ward, and we really appreciate all your hard work and dedication. Thank you. That's all for now. You can find out more in the COVID-19 at CUH document on the staff portal and in the other videos on this series.